Alice was not the child her mother expected. Claudia was 3 months pregnant when doctors told her she was infected with the Zika virus and that her unborn daughter would suffer from lifelong disabilities. Realizing that Alice will never have a childhood like other kids, her heart sank. But 4 years on, Claudia says the disability turned out to be a blessing.
She's loved by her neighbors, the family, and most of all by children who seem to be able to communicate with her better than I can. And she wants to play with them, but sometimes her disability gets in the way. She has convulsions, her muscles are weak, and she can't sit properly.
Alice is born with what doctors call microcephaly. Her brain is failing to develop fully. It's a consequence of her mother being infected with the Zika virus through a mosquito bite during her pregnancy. There are no vaccines nor cure for the virus that spreads through mosquitoes and sexual contact. In 2016, the World Health Organization declared Zika a public health emergency of international concern. The outbreak started in Brazil, spreading to Cape Verde. As a result of the epidemic, more than 3,700 babies worldwide were born with birth defects.
At the time, countries issued travel warnings, including asking citizens to delay pregnancies. There was this fear that Zika would spread from the islands of Cape Verde to the rest of Africa onto the rest of the world. But that did not happen. The virus suddenly disappeared, just like it appeared.
Dr. JORGE Barreto from the country's health ministry believes Zika ran its course, infected a large portion of the population, and herd immunity developed, halting the spread. Still, he fears Zika is lurking in the capital's drainage system. That's a breeding ground for mosquitoes, saying there could be another outbreak.
The immunity can be lost as the years pass. We believe people can be again unprotected and can be infected again.
Surveillance of infected Zika children has stalled due to the COVID pandemic, and mothers fear bringing their children to hospital.
Children with cerebral palsy need continuous physical therapy and good nutrition. Support and commitment of parents makes a lot of difference.
Because of the pandemic, Claudia too has been avoiding hospitals. When Alice is in pain or has convulsions, she plays a song to her that she would listen to when she was pregnant, to soothe her daughter's pain. Nicolas, Haque, Al Jazeera, Praia.